Hi everyone, welcome to Surgery Dada, and today I have a very interesting case for you. This is a case of lower esophageal stricture, and ideally this is a condition which is known as lower esophageal motility disorder. So come on and show into the screen, come here. So we are doing an endoscopy for this patient, and can you see this is the esophagus that we have, and if you see carefully this is the stricture. So this is the stricture that we have. Now this is the guide wire. We are doing a balloon dilatation for this patient. So how a balloon dilatation is done, just show this. So via this channel we have put the balloon, and now the balloon is taken inside. Pause. Balloon has gone, and now we are going to insufflate the balloon. Insufflate it. So we are basically doing a dilatation. Again. Deflate it. Deflate it. Taking it more down, more inside. Yes. Can you see the balloon is there at the stricture level? Now inflate it. Inflate it. Can you see we are doing a balloon dilatation? Deflate. Just lift inside. So this is basically at the G junction that we are having a fibrotic stricture. Yes. Inflate it. Inflate it. So inflating it to 25 mm and Hg. You can see this is the balloon. It is getting filled with saline. So this is what is a classical balloon dilatation, endoscopic balloon dilatation for the strictures. Okay. Deflate it. We'll try to. Can you see earlier the scope was not able to negotiate into the stomach. So after dilatation, we are able to negotiate into the stomach. Now this is you can say the gastric folds. You can see. We'll do a J maneuver to show you what is inside. Okay. So can you see a classical large hiatus here? Yeah. Okay. You can see this is the pylorus that you have. Simply, will let us see what is in for us in the duodenum also. Pylorus that we are having. So we are into the duodenum. You can see we are into the duodenum of this patient. So it's okay. There is some duodenitis. Can you see an ulcer? Can you see an ulcer? You need to take biopsy of this. Yeah. So we'll take the biopsy of this. Come on, okay. Up. Open. Yes. Thanks. Okay. Your photo leak. Now you can see on the J maneuver. This is a classical sliding hernia, but the stomach has gone. And can you take it more inside? Yeah. The location of the stricture. Okay. This is the stricture. So this is the dilatation, and we need to do a stricturoplasty for this patient. Balloon दोबारा डालना पड़ेगा. Okay. So now you can see we have kept the balloon distended, and we'll keep it distended for 30 seconds. And the future plan is to go for a stricturoplasty. So this patient is an ideal candidate for balloon dilatation. If it fails, you'll go for a stricturoplasty. If it still fails, then we'll have to do a surgery for this. And for such patients, we are going to do Lewis Tanner or maybe an Oringer's transhiatal esophagectomy with gastroesophageal anastomosis to be done. So you can see the esophagus which was not permitting the scope before the endoscopy, now it is almost distended and we can easily go inside the stomach. So I'll do a retroflexion. Okay, everything is okay. We'll do some suction and we'll get back. So you can see rest everything is okay. Speed photo ले लो,